Ladies and gentlemen, welcome aboard the Toxin Zoom webinar. Hello， 歡迎大家嚟到我哋今日第3期嘅 Toxin。各位帥哥美女們，大家晚上好，我是你們今晚的主持人 Grace. A very good evening to our beloved audience. I'm your host for tonight, Grace. 我們 Toxin 將會在每周五晚上9點給你帶來最新研討會課題，請記得留守我們 Facebook 官方網站，獲取更多最新的消息。Our Toxin series will be held every Friday at 9 p.m. To keep you updated with the latest health topics, remember to stay tuned to our Facebook page to receive the latest news. 我們今天的研討會主題是午時間。Our topic for today is frozen shoulders. 我們舉辦這個活動的口號是疫情先溫情，醫者有使命。Our physicians are on a mission to share their knowledge and expertise during this pandemic. 那麼說到為什麼我們要舉辦免費線上研討會，這個疫情給我們的民眾帶來了很大的困擾，甚至也影響了一部分民眾的收入。The reason we are organizing this free webinar is because this pandemic has caused a huge burden to most of us and caused some of us to lose our income. 所以我們決定借用網絡平台給我們的觀眾帶來一系列免費的線上公益活動。Therefore, we have decided to provide a free online educational live stream to all of you. 我們的線上公益活動包括了一系列的研討會、幸運抽獎以及線上問診的環節。我們希望可以通過這樣的平台，給予更多有需要的人一個小小的幫助。Our free online sessions includes webinar, lucky draw, and free online consultation, as we hope that we are able to give back to the community during this period. 鑑於疫情短期內不會結束，越來越多的患者求助無門。As the pandemic continues, most of our patients are helpless and unable to seek treatment. 我們希望患者可以學會自救，了解治病的原因，預防病痛，通過運動拉伸和改變生活習慣，最大的程度緩解身上的疼痛與不適。We hope that our patients can learn how to help themselves, understand the cause of disease, prevent sickness, and relieve pain through home remedies, exercise, stretching, and a change of lifestyle. 每個星期我們會推出不同的課題，以求覆蓋各個方面大家會面臨的健康問題。We will discuss different topics every week in order to cover all aspects of the health problems that can occur to anyone during this pandemic. 接下來就到我們的幸運抽獎環節。我們會在每周的線上研討會中抽取一位幸運兒來贏取我們周薪價值300令吉的免費體態分析與治療。Tonight, a lucky winner will be selected. He or she will be entitled to win a prize worth up to 300 ringgit of free treatment with a full body and a posture analysis. 那麼要怎樣才可以參與我們的抽獎呢？很簡單，首先填寫幸運抽獎的 Google Form， 然後去到我們的 Facebook page 和 Instagram， 搜尋信 Osteopathic， 點擊 Like 和 Follow。接下來就是在 Facebook share 我們現在的這個直播，記得要 tag 3個朋友，然後設置為公開，這樣您就有資格成為我們的幸運兒。To participate in this lucky draw, firstly is to fill up the lucky draw Google Form, and then you will need to follow our Facebook and Instagram. Share this live on your Facebook and tag 3 friends. Remember to set your profile to public in order to participate in this lucky draw. 我們會在研討會的尾聲公布得獎的幸運兒，所以呢，你們記得要打起12分精神，留守到最後。我們的幸運抽獎活動將會在9點45分截止。We will announce the lucky draw winner at the end of this live session. Remember to stay tuned until the end. Lucky draw registration will stop at 9:45 p.m. 在我們進入今天的研討會之前，如果大家有任何的疑問想要諮詢我們的醫師，可以在聊天室裡發問。那麼有些比較害羞的朋友不敢在聊天室裡公開發問呢，也可以在研討會結束後私信我們，我們會盡可能的回答全部人的問題。Before we begin the live session, if you have any questions, please feel free to ask our physician in our chat box. If you wish to contact us privately, you may WhatsApp us and we will attend to you as soon as possible.
Sorry， 再來 lag 了，你的
哪裡？
這邊開始 after 那個華語的啦。
OK。
wait 啊。
Before we begin the live session, If you have any questions, please feel free to ask our physician in our chat box. If you wish to contact us privately, you may WhatsApp us and we will attend to you as soon as possible. 接下来让我来介绍我们的诊所。Sin Osteopathic 一共有3间分行，分别是在 SS2、科蹦和 Sri Kembangan. Next, we will introduce our clinic branches which are located at SS2, 科蹦 and Sri Kembangan. 我们结合了现代脊椎调整技术、传统医疗法加物理治疗的方式，为患者提供一站式的治疗服务。Sin Osteopathic is a one-stop clinic specializing in the modern chiropractic techniques, traditional Chinese medicine, and physiotherapy. 我们的诊所传承了3代将近50年的医疗知识与经验，到访的病人就不必担心该如何选择怎样的医疗服务。我们专业的医疗团队可以根据患者的病情提供最合适的治疗。Invaluable knowledge and techniques have been passed down throughout 3 generations for almost 50 years. At Sin Osteopathic, our professional physicians will determine the best course of treatment, either modern chiropractic techniques or traditional Chinese medicine methods, depending on the patient's condition individually. 好消息，好消息 ，Good news！ 我们的诊所会在下个星期2正式营业。想要跟我们预约的朋友们，可以扫这个2维码，跟我们的后勤人员做预约。我会把联系方式放在这个聊天室里。Our clinic will reopen next Tuesday. For those who would like to make an appointment with us, you can contact us through this QR code. I'll also leave our contact information in the chat box below. 接下来我会播放我们诊所最新的 SOP 短视频，以确保每个人的健康与安全。We will now showcase a video regarding the latest SOP carried out at our center before each patient undergoes their treatment to ensure everyone's health and safety. 提醒刚刚进来的朋友，我们的幸运抽奖活动正在进行中。要参与的朋友呢，赶紧填写我们聊天室里的 Lucky Draw Google Form， 里面会有详细的报名步骤。我们会在研讨会的尾声公布得奖的幸运儿，请记得留守到最后。我们的抽奖活动将会在9点45分截止。To our friends who just joined our live webinar, our Lucky Draw session is still going on. You can find our Lucky Draw Google Form and steps in the chat box below. We will announce the lucky draw winner at the end of this live session. Remember to stay tuned until the end. Lucky draw registration will stop at 9:45 p.m. 我们有请今天的讲师 Dr. Sky 和 Dr. Nicholas. Let's welcome our speaker today, Dr. Sky and Dr. Nicholas.
Hello everyone. So 今天我们的题目是50肩。So 肩膀痛就一定是50肩嘛？其实50肩在医学上它正确名称叫做粘性关节炎。它主要的形成呢，就是因为我们关节里面的关节囊发生炎症而有那个粘连。So 另外一个它名称呢就叫做冰冻肩。所以为什么它有那个 frozen shoulder 跟那个50肩的 differentiate 呢？ frozen shoulder 其实就是50肩来的， But 为什么它叫50肩呢？其实它叫50肩，是因为这个冰冻肩呢，多发生在那些女生以前呢，就是发生在女性50岁的时候会发生的，所以慢慢他们就叫做50肩了。但是现在的人呢，他3C 产品很多 ，right？ 还要看电话啊，用电脑啊，所以这个发病的年龄呢，就越来越提前了。我在临床上啊，就看到很多有些30岁、40岁啊，他们都有这个发病这个现象了。以后可能会变成30肩、40肩都有可能。这个 frozen shoulders 呢，其实就好像你的关节、你的肩膀、你的 shoulder、你的关节囊被 frozen 了，是 freeze 了。它的症状会怎么呢？就是你的活动受限啊。一般女性会发生的症状是你梳头，上不到那个头，开始会痛，或者你要扣那个内衣，扣不到会痛，这个就是一个 frozen shoulder 的症状。before 我们进行教你怎样去treat 你这个 frozen shoulder 之前呢，这样我就叫我的另外一个 chiropractor 来为你解释一下我们的关节里面的结构啊。Okay, please welcome our Nicholas share about the frozen shoulders.
All right. Thank you very much, Dr. Sky. I'm Dr. Nicholas. I'm a chiropractor for Sin Osteopathic. So today we're going to talk about frozen shoulder. Now, before that, we will go through several different conditions for shoulders, and then we'll jump into the main topic for frozen shoulder. Okay, so now, do you know which joint has the most mobility in your body? Now, if you don't already know, and if it's not obvious enough, it would be your shoulder. So let's first talk about its structure. Now, this is the anatomy of your shoulder. It comes in 3 different parts, all right? First of all, you have your humerus, you have your scapula, which is your shoulder blade, and then you have your collarbone, which is your clavicle. So these 3 bones here, they are a ball and socket joint. So that makes up your shoulder joint. Now, moving on, we have the muscles as well. So in order for your joint to move, you will require muscles, correct? These are the primary muscles that will help move your shoulder joint. Now, they are called the rotator cuff muscle. And in this rotator cuff muscle groups, you have the supraspinatus, the infraspinatus, the subscapularis, and your teres major and minor. Okay, so these are the basic shoulder movements, okay? Now, if you're a healthy individual, you should be able to perform these 5 motions here without experiencing pain or even like feeling stiffness and all of that. So if you have a healthy shoulder, you can actually try it now, all right? You can do the first one, which is flexion, extension, all right? Try doing these motions right now and see if you're feeling any pain or any discomfort.
你家里面，如果你 suspect 你的家人或者你妈妈或者 father 不一定是女性的，其实男性有可能有这个问题的，你要 check 咯。有些人的手啊，举上去才开始痛了啊，或者能不能摸到耳朵啊，能不能上到去 full range 啊，手能不能放去后面，旁边拉伸上来，电不电到耳朵？可不可以去到90 degree 先啊？其实电到耳朵是 full range 啊，更加好啦。如果你可以上到更多，我们可以往外旋啊，外旋的动作或者内旋，好像你叫摸肚子啊，其实有些人摸不到的嘛，一摸肚子啊，他这个 shoulder 会很痛，这个可能就是你有其中一些发病的症状了，可以来 check 一下你究竟有没有这个问题，这个叫 range of motion 了。
Okay, so now we will jump into and talk about some general shoulder conditions. So first of all, I want to show you guys this picture here. This is the brachial plexus. Now, as you can see, there are many lines, right? Many yellow lines. These are all your nerves that are coming right out straight from your cervical spine or your neck, okay? So they travel down from your shoulders to your elbow and all the way to your hands. So nerves are supply motion, okay? They are the one that send signals to your muscles, telling your joints to move. And if let's say something happens at the shoulder, maybe you have shoulder pain, but sometimes the problem may not necessarily be there. It could be because of something else, right? So a lot of times the nerves may overlap, and let's say if there's an misalignment at the cervical spine, or let's say if there's an injury at any of the nerves, the signs and symptoms may present not just at the neck, but at your shoulder and at your elbow and subsequently at your hand. It could be like an electric shock, maybe like a radiating pain, or maybe numbness. So the picture on the right, you can see if let's say something is not so right with the C4, C5, or C6 segment, and you can feel it at your shoulders. But if it's like a C6, C7, C8, then it's more feelings at your hands.
So 刚才 Nicholas 讲的就是，其实我们的 shoulder 问题不一定是出现在我们的肩关节 ，sometimes 我们 cervical 就是我们的颈椎受到我们的神经的压迫，也会导致一些我们的在手臂痛的一些症状。So 我们在右图我们看到很多不同的颜色，其实就代表我们不同的关节。如果我们那个神经受压了过后，就是它某一个 region 就是某一个手部的范围那边有不同的个症状 ，sometimes 它可能会麻痹啊、无力啊、麻木啊，所以这些未必是我们的 shoulder 的问题的，但是我们的手能动，我们有 feeling， 全部都是要靠我们的这个神经去传导的 ，OK。
Okay, next we have referred pain. On this chart, all right, I find it very interesting as well. So let's say you have pain at your shoulder, and the pain can be there without you moving the shoulder. So that means that it could be something else rather than just the joint already. So if you can see this picture here, let's say if you have pain on the right shoulder, especially the part behind, then it actually could lead to your liver and gallbladder. Maybe it's trying to send a signal. So that way it actually sends up the signal to the shoulder. So you might feel shoulder pain, but actually something may not be so right at the internal organs. So you should know that the human body is so complex, right? Sometimes it's like a lot of the nerve supplies that they come together. So that's why we have referred pain. And at the left side, you can see if you have left upper shoulder pain, maybe you could look into the lungs or even the diaphragm. So that's why it's very important to get your condition checked out by a professional. All right, so next we have localized shoulder conditions. Now, these conditions are purely on the shoulder. So nothing to do with the spine, nothing to do with the neck. This is purely the shoulder. First picture on the left side, it's a torn rotator cuff. Now, remember the muscles that we discussed in the first slide, right? The muscles help your shoulder to move. So the tendons of the muscles attaches to the bone in order for the shoulder joint to move. So sometimes, let's say if there could be many repetitive activities, let's say cooking or maybe lifting heavy things, sometimes even accidents, right? You can, there will be either a tear or a complete tear or a partial tear to the tendon. Next, similarly, is can be caused by accidents as well. So that is like a tear to the ligament between the joints, okay? So first you have tendon, next you have ligament. And then the third one here is shoulder impingement. Now, the shoulder structures are very complicated, and there's not a lot of space in between. Let's say if there's a lot of friction, right? And you could get like a bone spur, right? What if a bone spur develops? So it will be poking all the other structures, causing pain. The other one down there is a bursitis or a swollen bursa. Now, usually bursa is like a cushion. It is filled with a small little fluid-filled sac, right? It helps to reduce friction of the shoulder, but if it gets irritated, okay, it will start to cause pain. And of course, once again, not a lot of space at your shoulder. So if it's inflamed, if it's zong and stuff, then it will cause a lot of pain. And lastly, we have arthritis and degeneration. I think all of us, as long as we live, right, someday we're going to get arthritis. It's just a matter of time or whether how young we're going to get it.
刚才 Nicholas，我补充一下，刚才 Nicholas 讲的就是这些是真正关于我们 shoulder 的一些 condition，就是我们肩膀真正的发病在肩膀的问题，有些是它的肌腱有可能有 tear 有断裂啊，有撕裂啊，哎，它的韧带啊或者那个肌腱有撕裂的感觉啊，它有这样的发病的原因是可能你拿东西啊。太大力啊，或者拿 gym 一直大力的去拉它，或者你 accident 肩部撞击到啊，这些都可能导致我们的那个肌腱我们韧带会断裂，或者我们有 bone spur，就是我们有骨刺的出现，或者我们年纪大了，慢慢会 degeneration， 会一些钙化的情况，就会导致我们的囊肿发炎这些就会慢慢出现 because of 我们的 aging 了 ，OK？
All right, so next we will move on with X-rays. Now, we don't have superhuman vision, right? So sometimes if like there's a trauma, all right, if there's an accident, we definitely need X-ray to really look into things. So X-ray mainly focuses on bony structures. So if you suspect a fracture, then we will send off an X-ray. Now, the first picture here, we can see that obviously there's a fracture at the humerus bone here. So this is quite a common spot. Next up here is the clavicle bone. You'll be surprised, even like I would say adults, if they're not ready, if they didn't do their warm-ups, right? If they were to do a somersault, they can actually result in a clavicle fracture. Yeah, surprisingly. And the third picture here is a dislocation of the shoulder. As you can see, the shoulder is not in the socket joint anymore. So the entire thing has popped off. Okay, next we will look into MRI. MRI looks more into tendon.
Sorry 刚才那个就是说you go back to just now the page。这些就是一些关于我们的肩关节骨折的问题，刚才都讲了，我们眼睛呢其实是很难 see through，所以我们就需要一些 X-ray 来看我们有没有 dislocation 好像我们跌倒有可能发生 fracture， 有可能发生那些 dislocation， 就是脱臼的问题的，所以我们就要靠那个 X-ray 去 diagnose。其实基本上有经验的啦，其实我们摸下去大约都懂它有没有那个骨折或者 dislocation 我们都懂的，但是如果我们要真正的去了解更清楚的话，我们通常都会建议他看那个 X-ray， 因为好像骨折的话，其实我们叫 hairline crack 那些很小的骨折啦，我们叫crack hairline crack 的话，其实它不需要 cast 的，它都能复原的。Okay, for the MRI.
Right, so for MRI, MRI focuses mainly on tendons and ligaments. So if you suspect if there's a tear in the muscle, then we will send you off for an MRI. Okay, so the first picture here, this is an MRI of the shoulder. Now, similarly, this is the humerus. As you can see, the bone is black in color, whereas the muscle here is sort of grayish. But then you can see that there are these white spots. Now, these are different signals already. So this is actually indicating that there is a tear in the tendon itself. The next picture here, similarly, same thing, MRI of the shoulder. So black color is the bone, all right, and gray color is the muscle. As you can see towards the end, you can see the tendon is slowly becoming black. So what does this mean, right? This is calcification that is happening. So the tendon is slowly becoming like a bony structure. So it's slowly hardening. A lot of times this can cause by stress, all right, stress to the joint itself, and also maybe a past trauma or injury.
Okay, so 如果我们照了那个 X-ray， 它没有那些 fracture 的问题，也没有 dislocation， 但是你的手还是很痛还举上来还是非常非常痛，可能你晚上睡觉它都一直在那边痛，它不会 disappear 的。So 这个时候我们就可能会 suggest 你去做一个 MRI 去 check 究竟你的 tendon 你的韧带或者你的肌腱有没有一些 tear， 有没有一些断裂有没有一些撕裂的那个症状。So 我们唯有照 MRI 才可以看到这些比较 details 的东西了 ，X-ray 我们是看不到的。So even though 好像我们的 spine 啊，我们要看我们神经啊，我们的还是需要以那个 MRI 来 check 的。
Okay, so now the main topic, frozen shoulder. So frozen shoulder typically it presents with pain and stiffness at the shoulder joint. Now the entire duration can range from a year to 3 years. And this solely depends from people to people. Some people may have it faster, all right? Some people can deal with frozen shoulder within just a year, whereas some people may take a little longer. But ultimately, what it is that the connective tissues, all right, at the shoulder joint, it will tighten and therefore restricting movement.
OK， for 这个就是其实这个我们叫做 frozen shoulders 啊，50肩啊或者冻结肩，所以它的情况啊，它的痛啊，可以一直维持到1到3年都有可能。OK。So 它的韧带啊肌腱它因为它 frozen 了啊，它变成它的那个 socket 那个位置啊卡着 ，right 卡着粘在一起啊，所以你的那个 space 啊不够，所以你拿上来啊那些它都会比较辛苦，比较难去完成的，因为它有几个阶段啊，它有发炎期，然后 frozen 期，它解冻期有不同的阶段，所以最简单的理解就是你的整个 shoulder。放去我们的冰箱那边，慢慢变成水变成结冰了这样的感觉，这个叫 frozen shoulders 啦。
The video here, as you can see, the left side is the shoulder that is frozen, and the right is the normal shoulder. Typically, it will get stuck at a certain range. Okay. Now, frozen shoulder has its stages. So stage 1 is the freezing stage, whereby you will feel a ton of pain, all right? This stage here, typically the first 2 to 9 months, all right? You may feel a lot of pain, but you still have motion, okay? Just a lot of pain. And it's slowly reducing the motion. Now, second is the frozen stage. It's about 4 to 12 months here. The pain will slowly reduce, but then you realize that the shoulder is starting to get stuck already, really cannot move it anymore. And the last stage is the thawing stage, is 5 to 24 months. And at this stage, your shoulder will normal. So reduce in pain, and of course, you slowly regain your normal motion.
Hello. So for 这个图呢，我们可以看到他刚才的解释就是我们 frozen shoulders 好像我们这个50肩呢，其实分了3个阶段。第一个阶段呢，其实我们叫做开始要 freezing， 就是我们的 shoulder 开始要冻结起来了的啊，开始要 frozen。所以我们这个阶段其实以真正来讲，我们叫做发炎期啦。OK， 发炎期就是开始要结冰的时候，多以疼痛为主。所以疼痛它会睡觉很痛啊，手拿出来很痛啊，一出力就很痛啊，这个就是以疼痛为主。所以慢慢你就会进入一个我们叫做冰冻期。冰冻期是 frozen stage 啊，它已经开始是硬了的，它是硬了的，所以它是活动受限，你根本没有办法拿上去那个头那边的，你不能梳头啊，你完全不能做这个动作，已经是很痛了的啊，过头做不到的。所以内旋外旋都会受限了，然后慢慢其实它要过，可能它痛1年过后，1年半过后，2年，它开始慢慢觉得它开始解冻了解冻了，因为你开始动啊，因为它痛到麻木了 ，right？ 它痛到麻木了，然后你可以 bear 那个痛，然后你继续做东西啊，它慢慢它就解冻。其实我们怎样呢？我们建议那个发炎期啊，我们不建议才去做那个推拿，大力推啊，大力去拉。其实我们不建议。其实如果你过度推拿，可能有导致那个肌腱断裂有可能呢，或者你会觉得你太大力拉，它 misalignment， 或者越来越发炎。你晚上你去看医生如果他帮你做这个frozen shoulder，很大力推你，他晚上睡觉的可能很难，因为他发炎太孤立了。OK？
Okay, so for frozen shoulder, why is it important to know who is at risk? Now, because frozen shoulder, we call it an idiopathic condition, whereby actually, to be honest, until this day, it's not very well understood why it happens. So it could be two things. One is idiopathic, which is we don't really know why. But secondly is because either you have a previous trauma, right, or an injury to the shoulder itself. So, but what we know now is we know which criteria or who is actually at a high risk of having frozen shoulder. Now, first of all, is females. All right, females has a higher percentage than males, and females who are at the age of 40. So, starting 40 to 50, this is the age where people commonly will get frozen shoulder. Next is people with the condition of diabetes. So you have high blood sugar, a high percentage that you would get frozen shoulder as well. And of course, lastly, like I mentioned before, either you had a previous trauma or that you've been casted before, whereby the joint has been isolated and not moved in a very long while. So that also will increase your chances.
他这边讲到谁是发病最容易有得到这个 frozen shoulders 的人群呢？其实以我们 research 来讲啦，女性居多的，其实男性都会有，但是女性居多，就是它的发病会在40到50岁之间现在越来越早了。刚刚我讲了的，说糖尿病病人会比较容易患有这个问题。还有一个就是，如果你有受伤过，你有做一些 cast， 就是你长时间你修的是没有去动的可能你这样 cast 了3个月或者2个月 then 它开始有这个问题这个是有可能的，因为你frozen shoulder就是你不动你的关节，慢慢变成 frozen。
Okay, so how to diagnose? Usually frozen shoulder is what we call a ruled out diagnosis. So of course, like remember the conditions that we discussed just now, like those fracture, maybe even a tendon tear. So those things will need to be ruled out first. Make sure that they are not those, all right? So typically it can be diagnosed with your presenting signs and symptoms, all right? How you feel when you come to the clinic, and of course, history taking. This is why it's so important to see a professional. We will ask a lot of questions regarding when did it start? How did it start? How are you feeling now compared to how it was? That's why. So you have to be patient with us, because otherwise we will never truly know what kind of condition that it is. Okay, now next we have treatment. So the main goal for treating frozen shoulder is that we want to reduce inflammation and stiffness. So by doing this, we're able to promote a full range of motion of the shoulder, right? Our main goal is honestly trying to just get you to do a full range, have a full range of your shoulder. And of course, we would also want to loosen up the surrounding shoulder muscles. Now, the treatment that we provide at Osteopathic would include adjustments, shockwave therapy, acupuncture, electropads and electroacupuncture as well, and also physical rehab exercises.
So for 这种50肩的人呢，通常我们诊所会怎么样做？我的 main goal 就是要把它做成 full range， 就是现在他摸不到头，他梳不到头，他可能扣内衣比较难扣不到。所以我们的 main goal 最终的目标就是要帮他们找回他们的 mobility。So 他的 inflammation 就是他们发炎呢，我们要把它发炎弄低，然后它硬化的，我们要帮他的肌腱肌肉做一些运动或者我们的诊所呢，其实做这一类的50肩呢，我们建议尽早做越好 ，because 你 imagine 一下你的水放在冰橱那边还没有结冰的时候还没有结冰到很硬的时候，就快点做，其实很快好的。So 我们的诊所会怎么样做呢？好像我们会做一些调整我们有一些比较先进的 machine 我们会做 shockwave。或者我们会做针灸或者电疗之类的。其实frozen shoulders 我们很建议他们去做一些物理治疗。你要多动那个 shoulder， 它才会好的比较快，它会解冻到比较快。OK。
Okay, so next let's talk some real cases at Sin Osteopathic. Now, our case one is a 50-year-old male. So he came to the clinic with frozen shoulder after all the examination. Now, treatment-wise, what we did was electroacupuncture. So this was mainly to loosen up the muscles and the tendons. He was 50% recovered after the first treatment. So with the angle that he came in, it was improved by 50%. And by the third treatment, he actually achieved full range of motion at the shoulder. The second case is actually a 40-year-old female. This one's is slightly complicated because the patient has actually gone to a few different clinics, but they have yet to actually find a solution for her issue. So with this patient, we use shockwave therapy along with manual physical therapy, so like adjustments, soft tissue, muscle stripping, and all of that. And of course, with exercise as well. Now for her, it took about 1 to 2 months and she was 95% recovered.
OK, so 我 share 一下我们 Sin Osteopathic 一些治疗的方案跟 real case 给你们了解一下。So for 第一个 cases 啊，其实他是一个 uncle， 一个 patient 的爸爸，他是50多岁了，差不多60岁了。So 他来的時候是很辛苦的。然後我問他 uncle 你痛咗幾耐啊？佢同我哦2個禮拜啊，2個禮拜個手攞唔上啊。然後我又幫他 check。其實他真的是開始要 frozen 了，就是要結冰了的。So 我就 check， 其實他的韌帶啊，他肌腱他拉到非常非常的緊。So 我第一次我就幫他做比較輕的東西，我就幫他做這個電療，我幫他做針灸，然後我做那個電療。So 他第一次啊做了過後啊，他的 range of motion 啊，他 improve 了 50% 了，那好很多 50%。So 第二次他到回來的時候啊，我在他講，哎，我好咗一半了，好咗一半。然後第二次我幫他做的時候，也是做差不多的東西，要幫他做電療，然後我們還幫他做一些 adjustment for 他頸椎，因為那個 uncle 的頸也不太好。So 我們的頸椎為什麼要調整呢？調整了他的那個我們神經啊傳導啊，可能你頸椎有壓迫， then 你一直做 shoulder 它不會好的。So after 你 adjust 你的頸椎啊，我們的神經傳輸好了，我們的頭腦會自動會派兵去做修復的啊。So 差不多3次過後，他講，哎，我唔嚟啦，我好晒咗啦。啊，他直接在這邊表演給我看，哎，我唔嚟啦，我下次唔嚟啦，我好晒咗，也有這樣的。但是 for 這樣的 case 啊，建議他來做 follow up 是他要在家自己做運動 because 他已經開始有這個問題啊，他會慢慢倒回來的，就是看你平時有沒有去保護他 right。 So for 第二個 case 呢，這個是40多歲的女人來的，她去了很多地方啊，不是覺得她來的時候啊，根本啊攞少少都攞唔到嘅，旁邊不可能90度了，一打開一點點啊，她的那個 shoulder 好像夾着這樣的，它是直接夾着的，根本都打不開的，這樣夾住啊，哪上又不能，哪旁邊又不能的。所以他去了很多地方，他做了半年的 physio 了的。Then 他很硬，就是他的粘連很厲害，我們叫連連很厲害。所以我們一開始怎樣做呢？我們先用 shockwave 幫他打，要軟化的肌腱跟那些韌帶。所以打這個 shockwave 的時候，它不單單可以把那個韌帶跟肌腱弄鬆，其實它的原理是它可以打下去的時候產生很多的空氣在裡面。So 很多空氣在裡面的時候，它會 reactivate 它的 cell， 它的細胞會活化它的細胞。So 它活化了細胞，它沒有粘連這樣厲害，它的 range of motion 慢慢好了過後，我們還有做一些 manual physical 的 therapy， 就是幫它做一些 stripping 啊，就把它的肌腱啊再慢慢再弄鬆 because 它黏着可能半年了，很難打開了的嘛，要慢慢把那些肌肉肌腱慢慢再順回它，再拉回去。So 其實 frozen shoulder 的治療啊，有些好像他這樣的 case 啊太久了啊，是需要時間的。So 他慢慢這樣做，教他還有做一些 physio， 我們做完了過後再教我們的 physio 幫他做一些運動。So 他大約治療了1到2個月， ，so 它 recover 了95%，所以越早做要越好了。OK。
All right, thank you, Dr. Sky. So just to add on a little bit more, I guess about shockwave therapy is that it uses acoustic waves, okay? So it's mainly to break down scar tissues in the shoulder joint. And this, of course, in turn can help to promote healing faster, promote more blood flow at the area, so to speed up recovery as such. Okay, so now we're going to teach you some exercises that you can perform at home if you think or if you have any kind of shoulder pain. These exercises can really help. But before that, I just want to inform everyone that there is a giveaway alert. So if you have not registered yet, please be sure to do so because we're giving out a free 300 ringgit worth of treatment voucher, including a full posture analysis. So if you have not, please be sure to do so. And of course, if you have any questions regarding today's topic, it could be either in Mandarin, in English, no problem. You can leave them in the chat section so that we can answer them in a bit. All right, so the first one is called the pendulum swing. This is a very recommended exercises for people with frozen shoulder. All right, so for pendulum swing, mainly what it does is it utilizes gravity. All right, when you place your shoulder forward, gravity pulls your shoulder down, so creating sort of a space between the shoulder joint. Now you can do this either in a clockwise or anti-clockwise motion, and it is recommended 10 repetitions and 3 sets.
OK，for 这个我们会建议你做一些物理治疗，去把你的 frozen shoulders 解冻。So 这个 pendulum swing 我们华语叫做钟摆钟摆的运动，就是好像你可以把你的手往地上那边放，然后以 clockwise 就是我们的顺时钟或者逆时钟去做一个旋转，钟摆的旋转的运动，所以我们可以做10次，我们做3 set。所以当你将手放下去的时候，我们地心吸力就会把你的粘连的地方去拉开。
So pendulum swing has different variations, right? Not only just clockwise and anti-clockwise, you can also do it in a cross section. So you can go up, go down, go left, and go right. Now, once you're comfortable with this motion, right, you can actually start by making it a little bit more difficult. But of course, do it at caution. Do it with only what you can take, all right? So I would recommend carrying a light weight if you can, and then this will actually further help to create that space between the shoulder joint. So similarly with this, you can do it for 10 repetitions and for 3 sets as well.
So for 这个 pendulum swing 就是我们钟摆活动不单单是转圈，就是只是 clockwise 或者顺时钟或者逆时钟，我们还可以，因为我们的手的关节活动是我们全身最大的，除了转圆圈之外，我们可以做向前向后的一个钟摆，或者向左向右的一个钟摆活动。所以这个如果你都没问题的话，你要好的快一点的话，其实我们会建议你拿一些 weight， 一些重量在你手那边，但是不是很重的，可能看你的人的力度有多少，跟你的身形啦。所以如果你不是很高大，也不是很有肌肉的话，比较瘦弱的女生，我们会建议她拿一个2 kg 或者3 kg。如果还是觉得太重，你拿1 kg 都可以。如果你家里没有那个weight， 我们没有那个weight 的东西，你可以拿个水瓶 ，OK， 没有力你拿小一点的水瓶装水，你去这样摇，向前向后摇如果你比较能有力的，你可以拿大只的水瓶来这样摇。所以还是一样，我们做10次，我们做3 set。So 3 set 过后了它就会比较你的 range of motion， 其实你做了这些的话它都会有一点解除那个粘连，所以你的会比较大的幅度，你可以比较能够碰到头拿上去比较高那些都会有进步的，但是这个需要时间的运动。
All right, next is wall walk. You can do this in two variations. You can face the wall. If you face the wall, meaning that you're doing the exercise in flexion. And if you face the side, meaning that you're doing the exercise in abduction. So depending, of course, now, if you're really in pain, then you just be very careful with this. So only go until as far as you can reach. If you cannot go any further, it's okay. Now, when you reach towards the end, you can just lean in slightly to the wall just to give it a little bit more stretch to the muscles. But yes, so that would be wall walk.
OK，这个我们叫做爬墙运动。我们爬墙运动有分两个部分，一个就是从我们的眼睛前面这样爬 ，OK， 前方的；一个就是在 side 旁边这样爬上去。So 这个我们要很小心着做，因为我们是靠手指的力量，慢慢一个一个这样爬上去，慢慢贴到那个墙为止。So 你每一次到了那个最高那个高度，觉得不行了，你可以在那边画一条线，然后这个很重要，大家要听啊，你放下来的时候要慢慢放下来。有很多这样爬了上去，手这样到了，手这样丢下来，这样会更加的伤的啊。所以你要慢慢这样爬墙，爬到那边画一条线，然后可以再高一点嘛，慢慢每一次都要高过那条线，然后到了那个最痛的地方，向前推一下，去做一下 stretching， 把你那边的肌腱拉松一点点。So 下来的时候，记得那个手如果没有力，慢慢用另外一只手慢慢扶着下，这样才是正确的我们的爬墙运动啦。记得用手指一个关节慢慢这样爬上去。Okay.
So just to reiterate what has been said is that when you guys reach the top, okay, so after doing the entire exercise, just be careful when you're about to bring your hands down. So don't bring it down too quickly, or you can use the other hand to support while bringing your hands down. Okay, so last but not least, we have towel stretch. Now this one will seem a little bit challenging because if let's say truly it's a lot of pain, right? Some people just cannot reach to the back at all. So if you cannot do this, it's okay. The first two exercises are truly enough. But if you can try this towel stretch. So of course, remember to switch sides. Once you're done with the right side being up, you can switch over to the left. So it will work on both sides. Recommend 10 repetitions and 2 sets between each side.
OK， 这个运动呢，就是专针对那些扣不到后面内衣的女生的。So 如果你前面的对你来讲没有难度，都可以 full range 了，但是你还是扣不到内衣，你就可以做这个运动。OK， 你手拿一个 towel， 拿一个毛巾啊，就是右手拉左手，慢慢拉着上去，跟着它带上去。所以你的左手是不要用力的，是用另外一个手去拉。另外一个手是跟着罢了 ，OK， 所以它是要做10次，每一边做2 set。
Okay, so for further details or information, if you'd like to find out more on exercises, our team actually during this lockdown period, we've spent a lot of time, doing a lot of different exercises so that you guys can refer to. Mainly, we're doing actually everything from head to toe. So if you've got neck pain, back pain, you can refer to our website and there will be a very detailed exercises that you can refer to. So even with shoulder as well.
所以我们在这个 pandemic 期间呢，其实我们也没有什么都不做，所以我们也想到我们的病人呢，其实他可能不懂去做什么运动，所以我们就想了，我们把从我们的头痛、颈痛，慢慢到我们的脚痛、膝盖痛的运动，全部放在我们的网站那里。所以如果好像你颈痛，你可能去找我们的 exercise for 颈的，他会教你做一些颈部的 stretching。So of course 我们的这个关节我们肩关节或者 frozen shoulders， 我们运动也会在里面。So 大家可以进去我们网站去看，如果你有什么问题，可以 refer back 我们的网站那边，看什么运动比较适合你。So 我们的运动有分开 low impact 跟 high impact。 就是如果你一开始是很严重的话，就不要做这样刺激的，我们叫 low impact。如果你比较好一点好像你比较没有这样痛了，你可以看慢慢去我们的中间 impact 或者 high impact 的运动去做。所以一开始我们不建议你直接跳去 high impact 的运动去做。所以我们已经分到很 details 了的。
So of course, let's say after doing the exercises, you still don't feel good. Of course, you're always welcome to make an appointment with us. Now, we have come to an end of the presentation. So thank you very much for your time. So I'll pass this back to the MC. Thank you.
OK， 我要补充一下其实还有另外一个方法可以帮助这个frozen shoulders。在临床上通常我会怎样建议 patient 呢？我会建议 patient 呢，如果你的这个肩关节很多啦，是这样子，肩关节有些人讲他不懂为什么会发生。OK， 不懂为什么会发生，可能是 injuries， 可能是 CAS 可能是太久没有动会发生。其实是我想到有一个就是他们睡觉每天压一边，每天压这一边。So 如果你有这个 frozen shoulders 的 patient 呢，我平时建议他们最好就减少那个关节被拉那个效果。So 平时的话你可以坐在那些有靠手的椅子那边，就是不要给他去做很大的 stretching。除了你是在做很多个 reps 的运动之外，你平时最好不要给他拉，因为你发炎期你越拉它越痛的。So 好像你散步你可以拿个枕头，小小的枕头这样垫着它，压着它，这样把那个 space 打开可以，你不要给它拉着。So 你可以放个枕头，或者你睡觉的时候千万不要再压你有问题的地方。OK， 不要侧睡还有避免长时间不动。其实你不动它 frozen 的更厉害，所以你要适当的做一些物理治疗运动去改善。OK， pass back to MC。OK，
好，谢谢我们的讲师 Dr. Nicholas 还有 Dr. Sky。那接下来呢，我们会进入我们的 Q&A 环节。那在这个过程当中呢，我们也有收集了观众们的一些问题。那首先第一个问题呢，就是我之前有肩痛，是健身弄到的，然后过了一段时间好了很多，但是觉得力度没有恢复之前那样，是还没好吗
？for 这个问题你之前是健身弄到的，可能你的肌腱或者韧带有受伤，或者它可能有撕裂。OK， 可能是这个问题。我不懂你健身就拿多重，所以这个可能是 one of the reasons。所以你讲它 recover 它 recover 的话，它没有那个力是要练起来的，力要慢慢练起来的。但是你要看你真正的里面的因处理好没有。Because sometimes 好像你拿 gym 很重去拿的时候，它的肌腱那边它可能有裂了，或者它里面有流血 internal bleeding。So 淤血它没有清除的话，它对于我们的复原或对于我们的 recover 它好不完的你会觉得好不完但是这个能不能改善？其实可以改善的，但是你可能需要 make 一个 appointment 来看一看你究竟是什么问题。是你的筋的问题，还是里面有 blood clot 的问题，还是你的 shoulder 有 dislocation， 或者你有移位的问题？这个我们要理清一下。
Yeah, just to add on, it's like because it's gym, right? It's very a lot of tense, a lot of stress on the shoulder region. So sometimes what could happen is, let's say if there was an injury, and yes, so it could heal on its own, but if you don't have the proper like exercises or rehab to go along with it, right, it may not fully recover. So if it's at that stage, then you will never like go back to what you carry. So you will need to really see the proper exercises to really get back to where you want to be.
Okay, thank you, doctors. So 第二个问题就是我去看过中医针灸过很多次，抬手都没有问题， 但就是扣上内衣的时候，肩膀前面有一块肌肉摸起来特别硬，那请问这算是50肩吗？
你这个是one part 啦，我们50肩有分很多，你的前面肩膀呢，它的可能肌腱还有粘连，所以你的手伸去后面伸不到啊，所以我们有分很多是 stage 啊，不可能是你可能的 stage 已经是到了后面开始解冻期，把你前面这个地方没有处理好，因为你讲还有一块东西但是我没有摸到你那块东西究竟是肌肉啊，还是你的骨有向前移顶着你滑膜囊，也是有这个问题会导致的。如果你是没有骨折或者其他损伤的问题啦，这可能是你还没有处理好前面肌腱的问题，所以它前面绑着，你根本都不能拉去后面的，对不对？所以你针灸基本上可以把那个韧带或者那个肌腱慢慢放松了，但是有些 region 还需要再做了。OK, Nicholas?
Yeah, just to add on, because like right now, if it's posture related, and if let's say everything else is clear, right? No fractures, no nothing. If it's posture related, nowadays during this lockdown period, we're all using like computer and stuff, right? So naturally, you would tend to have like this hunched up posture. So when you're hunched up, the shoulder tends to go towards the front, and then definitely it's just very difficult to hit backwards. So maybe it could be that, could be tight muscle, but we really have to examine in order to find out the true cause.
Okay, so for our next question, is frozen shoulder have to take any medicine to cure or just some basic treatment or exercises will do?
For this, not entirely, but also depending on their condition. If let's say truly they are very much in pain, all right, very pain, really cannot tahan, then we would, of course, only in that kind of scenario, then we would recommend like maybe perhaps you could go for a steroid jab. And then after that, only to continue with treatment, then that would, of course, be a better outcome rather than you actually suffering from the pain, and going through treatment will be quite difficult.
他刚才所说的就是如果需不需要药物治疗 ，right？ So for 这个问题Nicholas 就讲的，其实如果你是那时候已经痛到睡觉都睡不到了的 ，OK？ 你怎样动它都痛的 ，So 你可以去先吃一些止痛药或者do some steroid 或者一些针，你有非内固醇或者内固醇的药物可以消炎的，先把炎症压下去过后，再接受治疗会比较恰当或者如果你不要用 medication， 你不要打针你不要吃药，你可以先服药把它的炎症先压下来先，压下来的炎症它没有这样发炎了过后，then 我们再做further 的治疗会比较好。So 你的东西你有这样痛了过后，你不可以一下子就拉到很厉害的。刚才我讲了，你不能做那些推拿的，你只有 by stage 慢慢看你的 condition 来进行做治疗。
OK， 那到最后一个问题，那么如果是有肩膀，就知道肩膀是痛的时候，我们是可以用hot 还是 cold pack 来给它舒缓一下那边的疼痛。
OK， 这个问题很好这个问题很好。So 这个问题就是，如果你的是 after gym， 你的肩膀是很痛的 ，OK， 你可能你觉得你受伤或者扭伤你的手，你用 ice pack， 你用 cold pack， 你跟它 freeze down，OK。但是如果你是 for 这个 frozen shoulder 的病人呢，其实他建议他用 hot pack 的，因为你看他已经是解冻了 ，right？然后除了你是做了很多的运动过后然后你觉得很发炎，你可以放那个 cold pad， but 我们会建议他先 warm up， 去放了那个 hot pad 过后 warm up 了那个关节，它比较舒缓那个 muscle 了过后，再做一些运动这样就是最好对于 frozen shoulder 解决了。因为刚才他讲他肩膀痛，我不懂他是因为50肩的肩膀痛，还是他扭伤或者拿 gym 过后的肩膀痛。但是我两个都有回答到了。OK， Nicholas， any？
Yeah, a very good point, because I think a lot of us, we're just so confused, right? When to use ice, when to use heat. But typically, just keep a rule in mind is that after let's say something that just happened, right? Something just happened at the gym, or maybe you fell, sprained your ankle, then ice would be the natural choice to go with. But let's say for something that has been there for quite some time, it has turned chronic, okay? It's been several weeks, several months, then heat would play a better role. So it would increase blood flow at that area, and naturally would be a faster healing.
Okay, thank you for Dr. Nicholas and Dr. Sky for sharing the topic frozen shoulder today. So our Q&A have come to the end, and now let's move on to our lucky draw session. 那现在呢，我们就接下去又来到了我们这个幸运抽奖的环节。那我们有请我们的后勤人员来转动我们的这个轮盘。Now let's have our crew to spin the wheel and see who will be the lucky winner of the night. All right, congratulations to 廖来用。好，我们恭喜廖来用。好，那么如果你在的话呢，可以在留言区这边呢跟我们打个招呼。好，然后呢，请在3个小时里面呢联系我们的后勤人员，我会把联系方式呢留在这个 chat box 里面。好，如果今天没有获奖的朋友们呢，不要气馁，再接再厉，我们下个星期五也会有这个抽奖。To the rest of the viewers, not to be disappointed, because we will have another lucky draw session on our next live stream on every Friday. 那我们今天的 live 呢，已经来到了尾声，感谢各位参与。Talksin 下个星期五同样时间，我们下个星期的课题是 Hunchback 和breathing difficulties 驼背以及呼吸困难。那好，那么呢，我们就下个星期五见。